Welcome back. Arizona Liver Health is the state's leading liver clinic and currently the only liver specialty clinic in Tucson.
And nurse practitioner Vicki McIntyre is joining us to share the importance of focusing on your liver health. Great to have you here.
Thank you.
So what does Arizona Liver Health do so we can make sure that our livers are healthy?
What can you do?
And how does the clinic help?
Absolutely. We focus on all liver disease, and we take pride in taking care of all liver diseases in Tucson, to include, say, fatty liver, NASH disease, hepatitis B, hepatitis C, cirrhotic, end-stage liver disease, with a main focus right now of fatty liver disease, which is epidemic.
Now, when people hear that and they hear about liver disease in general, they think about people that drink too much. Is that accurate, that it's only that group of people?
Absolutely not. It is a huge component of liver disease, but actually obesity is the main cause of liver disease right now in the United States, and it leads to what we call fatty liver disease or non-alcoholic fatty liver.
And it's pretty common, right? And I know you said the epidemic, and I want to get to some of the signs that we should be looking for, but let's talk about Fibroscan. What's a Fibroscan?
A Fibroscan is a special ultrasound machine, and it's used just on the liver. And it tells us two main things, but very important things of the liver. It tells us the fibrosis, which is scarring of the liver, and it tells us the fat content, the percentage of fat in the liver. So from the Fibroscan, we can really tell someone what type of fatty liver they have, whether it's non-alcoholic, what we call NAFLD, or is it NASH, which is non-alcoholic steatosis. That's the one that leads more towards damage, to include cirrhosis and need for liver transplantation.
So how common is it? How many of our viewers, for example, need to be concerned about this? The majority of them, a certain percentage?
About 1/3. A lot of literature states if you take 100 people, adults 33 to 35 will have fatty liver, and out of that 35, maybe 10 will have actual liver damage from the fatty liver.
And you would never know it in some cases, right?
Absolutely.
What are some of the signs we should be looking for?
Well, and speaking of general of hepatitis or liver disease, it really depends on what kind of liver disease you had. Most of the time it's asymptomatic, meaning there are no signs and symptoms. It can be as mild as fatigue, joint pain, muscle pains, and it mimics a lot of other disease states. So a lot of times liver disease is not diagnosed in a prompt manner. But once again, it depends on what kind of liver disease that you have. Most patients, unfortunately, get signs and symptoms of when they have end-stage liver disease or cirrhosis. They end up at the emergency room and they have fluid overload, such in their ankles, in their abdominal areas, such as ascites. There may be some yellow changes to their skin, to their eyes, and even mental status changes where people get confused. So it's all over the board.
What can you tell us about medication that sort of helps improve liver health?
There's actually no medication approved by the FDA right now for liver health. There's a lot of research right now that they're looking at treatment modalities for fatty liver disease that may help with the fibrosis or remove some of the fat. The other treatment regimes are really specific for like hepatitis C, hepatitis B, but there's really no one medication that really promotes liver health.
But you said there are 3 things that we need to remember when it comes to our liver health. What are those?
I'd like to, from my perspective, you've got to diagnose liver disease early. Diagnosing is critically important, as in most disease states, but especially with liver. You want to find the liver before it is cirrhotic, meaning very scarred. If we can get the liver before cirrhosis, the liver will regenerate. If we can eradicate the disease, take care of the fat, the liver will regenerate. So it's very, very important.
Real quickly, age group. Are we talking maybe like over 50 years old? It can run the gamut.
If we're talking fatty liver disease, it's actually all ages. We even have a 17-year-old that we did a Fibroscan and is cirrhotic.
Wow, that's an eye-opener.
Because it follows obesity, and obesity is also epidemic in our nation.
Wow. Right, they go hand in hand.
And you guys are offering something very special, which we'll tell about here in a minute. But Vicki, thanks so much for joining us here.
Thank you.
Thank you, Vicki.
Right now you can get a free liver screening, and you'll even get results in as little as 15 minutes during your appointment. If you want more info, visit azliver.com or call 520-485-4000.
You're watching The Morning Blend. We'll be right back.